Hello. Public Health England has just launched the latest edition of Health Matters, which focuses on making cervical screening more accessible. Cervical screening is intended to detect abnormalities within the cervix that could, if undetected and untreated, develop into cervical cancer. Despite the success of the screening programme, screening coverage has fallen over the last 10 years and attendance in England is now at a 19-year low. Attendance is going down across all age groups. Not going for cervical screening is one of the biggest risk factors for developing cervical cancer. We're here to discuss what can be done by public health professionals, the NHS and local authorities to overcome the barriers to cervical screening and to improve attendance. With me here today are Kate Sanger, Head of Communications and Public Affairs from Joe's Cervical Cancer Trust, Dr Josephine Rwendi, Consultant in Public Health and Cancer Screening Lead for NHS England London Region, and Dr Penny Bevan, Director of Public Health, London Borough of Hackney and City of London Corporation. Kate, let me start with you. You're from Joe's Cervical Cancer Trust. Could you remind us about the incidence of cervical cancer and the impact of having a diagnosis?
So around 3,200 women are given a cervical cancer diagnosis every year. This equates to about 9 women a day. It affects women of all ages. However, among women under 35, it's actually the most common cancer. If picked up early, it's very treatable and survival for the disease is very high. However, for women who have been given a diagnosis, there can be significant long-term consequence of their treatment. These changes include loss of fertility, the physical impact of their treatment, the psychological impact of their diagnosis and their treatment, and also changes to financial situation, impact on ability to work, and changes to relationships or sex and intimacy.
Thank you. Joe, you're the cancer screening lead for NHS London. Could you describe the programme for us, its effectiveness and level of uptake?
So cervical screening is offered every 3 years to women aged between 25 and 49 and every 5 years to women aged between 50 and 64. So the cervical screening test in itself is we test apparently healthy women to see if they have any cervical screening cellular abnormalities, which if left untreated may actually lead to cervical cancer. And the test in itself, the screening test in itself, should not be used to investigate women who already display signs and symptoms of cervical cancer or indeed any other gynecological cancer. These women should be investigated and referred in line with NICE guidance or local pathways. Now, in England, we have a cervical cancer coverage target of 80%, but this has been falling over the last few years, as you said in your introduction. And in addition to an overall decline in England, we do see particularly low coverage rates in certain groups, such as young women in their 20s and 30s, in people who live in areas that are ethnically diverse or socially deprived, and also in inner cities where people are changing addresses frequently. Or moving in and out of the area. And there are also smaller groups that have particularly low coverage rates or uptake rates, such as people with learning disabilities and lesbian women. The programme is highly effective and it prevents about 3/4 of cervical cancers.
Thank you. As a Director of Public Health, what's your role in supporting the cervical screening programme locally?
Well, of course, the key responsibility for providing the cervical screening programme locally does rest with NHS England, but clearly as Director of Public Health and with responsibility for improving the health of the local population, we have a responsibility to promote and encourage uptake of the screening programme. And we do that through a range of activities. We have quite a deprived population in Hackney and quite ethnic diversity. So we work particularly on other health issues as well, but include cervical screening as part of our work on estates, as part of our work with particularly the Turkish and Vietnamese community, and others will be doing with their particular issues. So I think this is about using our contact with populations and with opinion leaders to encourage the uptake of what is a potentially life-changing and saving activity.
Thank you. Kate, in your experience, what are some of the barriers to cervical screening and how can we help people access screening if they wish?
Well, there's been lots of discussion about some of the different groups of women who are not attending cervical screening, and as we know across the board, cervical screening attendance is actually falling across the country. There is no one reason why women don't attend screening. There are many different reasons, some of them which we touched on, ranging from embarrassment to accessibility to language or cultural barriers, or to simply some women just put the test off or don't think it's an important test. And as there is such a wide range of barriers as well, there is no one-fits-all approach to increasing uptake. So any activity that is planned to increase uptake really has to address whichever those specific barriers are for that group of women that it's looking to address and increase uptake among. And this can range from national awareness campaigns to working with GPs which are underperforming, to work with them to establish ways they can increase uptake among their their known groups of non-attenders, to working with women in faith groups or community groups, and encouraging community volunteers to spread the message about cervical cancer and prevention.
Okay, thank you. Penny, then, what can local authorities do to support the uptake of cervical screening, given that provision through sexual health services has fallen away in some areas?
Well, clearly there's raising awareness, but there's also ensuring good access to services. The majority of provision currently is through primary care. And as this is a good thing, we are moving towards increasing the requirements for training and throughput of people in primary care undertaking cervical screening. It's becoming more difficult for particularly small practices to be able to offer this on a regular basis and when women come to the practice. So I can see that in the future, with the model of care that we are seeking to move to sexual health services in London, that's particularly for contraceptives and reproductive health services, that we will be looking in Hackney, where we will be having between 4 and 8 hubs with specially trained primary care staff who will be able to offer a walk-in or short notice appointment service, and also cover contraception and other issues as well. And I think that might offer a better accessibility and experience for women to encourage them to come. Clearly it's not part of the specification for sexual health services for sexually transmitted diseases or in other areas, but if NHS England wish to commission through the hubs that are being developed, and this is not uniquely in our area, but certainly across the rest of London, then I can see that will be a very good way of increasing take-up.
Good, thank you very much. Jo, then, what other initiatives are there to improve cervical screening uptake?
So within London, we're planning to send GP-endorsed text reminders to all women who are invited for cervical screening. We'll be working with Primary Care Support England. And this is on the basis of a randomised controlled trial that was run by Imperial in Hillingdon, which showed that sending text reminders can improve uptake by up to 4% across all age groups. In addition to that, we are looking to pilot the use of a smartphone app called MyGP to enable women to book their cervical screening appointment. We think that particularly young women may find this more convenient than actually calling the practice to schedule an appointment, and we'd hope that that would improve uptake as well. So in addition to that, we are doing more work with Imperial, who are currently undertaking a large survey of several hundred women to identify some of the behavioural barriers that Kate mentioned that actually stop women attending cervical screening. And we think that the findings of the survey will be very helpful in informing uptake improvement initiatives across the country. Penny did talk about screening within sexual health services, and within London we have had a particular project over the past 9 months, particularly to identify and target women who are overdue screening. So these are women who haven't had a screen in over 3 or 5 years, depending on their age. So what we have asked our sexual health and family planning providers to do in London is to identify amongst the usual group of patients attending their clinics, to identify overdue women and offer them opportunistic screening. We're very keen on the new models of primary care, which Penny has also described, because we think that some practices would be able to offer screening out of hours and on Saturday mornings, but maybe not individually, but in a federated model. So we think this would probably go a very long way in improving access for working women in particular.
Well, I think that's a good place to end the discussion. Thanks very much, everyone. We've discussed ways to overcome the barriers to cervical screening and to improve its coverage. Do please take the time to explore this edition of Health Matters, which includes recommendations and supporting materials, including downloadable infographics and slides that you can use in presentations and discussions with colleagues, plus some case studies. Thanks for watching.